Hello from the Heartland. My name is Jenna, and this is Smarter News. News when it matters and why it matters. Our Smarter series features unique people who help us think and live smarter. Well, a few weeks ago, we got an alert from the World Health Organization. This is specifically from Disease Outbreak News. And just a word to the wise, if you're looking to sort of ease your way into sleep, this is not the resource that I would suggest. Disease Outbreak News really lists off the different alerts that the World Health Organization is looking at around the world. So it's something serious. It's something we pay attention to. We don't chase every headline from it, but we do pay attention to it. And so the title of this particular alert was Acute Severe Hepatitis of Unknown Origin in Children. And so that's enough of a title to get your attention. Acute, severe hepatitis of unknown origin in children. And so this alert, and again, there was a little bit of an update to this. This happened in April, documented about 160 plus cases of this acute hepatitis. It was in several countries, so not just located in one. Let me just give you a couple examples: the United Kingdom, Ireland, Spain, Israel, the United States, Denmark, and beyond. It happened in kids 1 month old to 16 years old, so infants until teenagers. And there was a couple different symptoms that were associated with it. We're going to talk a little bit about, but nothing in particular necessarily as a parent, and I'm speaking personally here, that would make alarm bells go off until the infection got a little bit more pronounced. And by the way, in some of these cases, it got quite serious, even leading to a liver transplant in some cases. So that was followed up by additional information from the CDC. And actually, we just got some brand new information, and I want to mention this. One of the big lessons from the last couple of years of living through a pandemic has been the realization that all data is backwards looking, and we have to understand it's always changing. So the new data from the CDC said that we're looking at, in this country, the United States, more than 100 children with this hepatitis of unknown origin. The CDC is investigating these cases, looking to confirm them. They've spanned the last 7 months. It's in 25 different states that this investigation is taking place. There have been 5 reported deaths, 90% hospitalization, and 14% liver transplants. So that's some scary statistics. One of the other big lessons from the pandemic has been that while we really appreciate the information coming from all sorts of different organizations, I'm a little bit of a nerd, so I like having all this different data and statistics from health officials around the world. You really have to speak to people that come face to face with patients. And that's why I'm really excited about our next guest. I'm a fan of hers. And turns out she's perfectly positioned to talk a little bit about this because she's not only the mother of 4, but she's also a pediatric emergency medicine physician. Her name is Dr. Meghan Martin, and she's a part of Johns Hopkins All Children's Hospital. So she is treating pediatric cases every single day. I first learned about Dr. Martin, of course, through all great things, Instagram, social media, Dr. Martin bringing people together. And Dr. Martin has a personal account, Dr. Beachgem 10, and she will do short videos, sometimes folding laundry, which looks very similar to the laundry in my house, Dr. Martin, talking about complicated topics or sometimes easy topics. But either way, I always feel informed. So I'm glad to finally meet you over Zoom, face to face, and welcome you to Smarter News. This is really exciting. And I want to get a little bit of an idea of your background and share that with our audience who may be new to you. Did you always know that you wanted to go into pediatric medicine? Was that always a dream of yours?
Well, thank you for having me. I did always want to be a pediatrician. I always loved hanging out with kids and playing with kids, and just being young, I think, is really fun. Kids have a lot of hope and energy, and I enjoyed that. And I really, in medical school, I was on my pediatric rotation, and we were doing rounds. And I was like, this is so boring. And so emergency medicine is a lot quicker. And so I ended up as a pediatric emergency medicine doctor where there's virtually never any downtime.
And how long have you practiced in that particular position?
So I did pediatric residencies 3 years. My fellowship was 3 more years in pediatric emergency medicine. And I've been in attending for about 6 years now.
And through that time, you also grew your family. You have a bunch of kids that are all over the place. How old are they?
I have a 12-year-old, a 10-year-old, a 6-year-old, and a 4-year-old. And I basically had one in every stage: medical school, residency, fellowship, and as an attending. So I feel like I can't have any more kids or I'd need a new job or something.
I'm exhausted already hearing about that. I have 3 kids. So although I have realized, Dr. Martin, that as your oldest ones get older, they do become helpful. And I can see now how one could add to the family, although let's just knock on wood. And I think we're good. And you also have a series of different cats around your house. Is that also correct?
Yeah, we do. My first 2 cats are Salmonella, and then I got another new baby that came last week. Her name is Typhy.
Okay, wait a minute.
Salmonella typhi is typhoid fever.
Okay.
So I have to keep it. I have to keep it nerdy, just straight up.
Well, that again, this is all fitting the pattern of why you're the ideal person to talk to. Um, there was a part in your lead up to full-fledged doctordom, if you will, that you actually became a patient yourself. And I remember listening to you tell this story, and I think it's a really important story. Would you share that with our audience?
I can. November 17th of 2010, I was on my night shift rotation and I was sick as a dog. I had a terrible cold that my daughter, who was my only child at that point, she had RSV, and she had gotten me sick. And I came home one night, or I guess it was one morning because I was on night shift, and I could barely get out of bed. I felt terrible. And I ended up going to the hospital. And they initially were going to put me in like a fast track, but decided to kind of get me into the main ER. And they gave me a ton of fluid and antibiotics. And then all of a sudden, my blood pressure dropped out. I was septic. And so they rushed me over to a resuscitation room. I got a central line in my neck. I was started on some medication to keep my blood pressure up and my heart pumping strong. And I was in the hospital in the ICU for about a week, and I was actually discharged on Thanksgiving. And I don't think I have ever been more thankful in my life. But it was it's a different experience being a patient than being the provider on the other side. And it was a rough week. And I had some moments where I was a little nervous of how it was going to turn out, but I made it out with all my fingers and toes. So I think as a sepsis survivor, I'm here to just tell you, please do not neglect your health. It is really important, whether you're on night shift or not, to be taking care of yourself.
That's a good reminder, I think, for all of us. How do you think that impacted the way that you treat patients, that and also being a parent?
I think it's tough. Being a provider, you get into a groove and you start doing, you're going through your boxes and you're checking and you're doing this and that. And sometimes you have to step back and say, okay, this patient is a person. This mom is really nervous. Let's just sit down. Let's sit down. Let's take an extra second. Let's have a real conversation. What is your concern? What are you worried about with your child? Maybe we can address that rather than talking about how bad the cough is. What is your biggest concern? What do you think is going to happen? And sometimes we can get to where we're going and have a good, open, honest conversation going that route, rather than, me focusing on just exactly what the symptoms are for the kiddo.
That's really interesting. What are the types of patients that you see on a regular basis? What's a typical shift for you?
We see everything in a pediatric ER, anywhere from sore throat, rashes, fussy babies, all the way up to patients who are actively having a seizure, trauma patients, motor vehicle collisions, and then, cuts, scrapes, broken bones. So we do the full range of care for kids in all ages, all the way up to 21, to just being born.
One of the difficult things I realize as a parent, first of all that you perceive about parenthood when you actually become a parent goes completely out the window. One of the things that has been difficult for me to navigate in recent years is when to actually go to the ER. And we'll talk a little bit about that. I actually think there's been an experience in our family over the last couple of months that might really lend itself to this conversation. So let's talk a little bit about this acute severe hepatitis of unknown origin. First off, have you seen anything in your ER that would even raise an antenna that you could be suspicious of? That is this?
So at this point, this is still really pretty rare. We're looking at generally less than a dozen cases, per state. I have seen some cases of severe hepatitis in kids. Again, I'm in the emergency room, so we don't always have all the answers when I see the patient. I have seen lots of cases of very severe hepatitis. Some of them we find out answers to, and some of them that we don't. And this has been going on for a long time. So one of the big questions I think we have as a medical profession right now is, has this always been happening and we've just started picking it up? Has it always happened just a couple of years and we didn't pick it up? Or is this something that's new and different and we have to figure out what's going on? So we haven't always known the causes of some severe hepatitis needing liver failure. So, but again, I want to reiterate, this is very rare at this point. Like, this is not a common thing. Adenovirus is a common thing. We have seen adenovirus talked about a lot. Adenovirus is very common. It's a common cold and it can be a stomach bug. So if your child does get adenovirus, there are some things to monitor for, but it's definitely not a time to be super worried, because it is something that we see very commonly.
That's a really good overview. So I just listened to the latest CDC media briefing, and again, there could be another media briefing by the time our audience hears this interview. But you hit the nail on the head of a big topic of the briefing that the CDC even talked about, which was, we know that hepatitis can surface in children. We don't know if we're actually way more acutely aware of what's going on because of the last couple of years, because clinicians are really paying close attention to what's going on and trying to piece together and maybe testing for viruses that they wouldn't otherwise test for, because why not? Why not get more information? So this is the reason why adenovirus has come up. And so a little background on that, but I'll of course hand it over to you, Dr. Martin, is that in some of these children, either in the United States or abroad, adenovirus has been present in some capacity, but not in all of the patients, just in some of the patients. So what is adenovirus? How common is it? And what should we know about it?
Adenovirus is a common cold virus, and I can guarantee almost every kid, especially every daycare kid, will have it at some point over their first couple of years of life. There's over 50 different types of adenovirus. The vast majority of them are going to cause upper respiratory infections, cough, congestion, sore throat. Specifically in little kids, red eyes and sore throat is pretty common, but there are some subtypes that can cause stomach bugs or like gastroenteritis, vomiting, diarrhea, abdominal pain. And most of them are not going to have any concerning developments. We don't actually even monitor this. This is not a reportable illness. So we don't have a big database of how much adenovirus is seen around the country at any given time. So, but it's always been out there. It's always, for decades, we've seen adenovirus.
And can it cause hepatitis? Is that something that's been known about it?
Adenovirus has been reported to cause acute hepatitis in immunocompromised patients, patients that already had some sort of transplant, a heart transplant, a liver transplant, a kidney transplant, or they were undergoing chemotherapy for a cancer treatment or another treatment. We have seen adenovirus cause hepatitis in those patients, but never in young, totally healthy patients, which is primarily the patients we're seeing now get sick.
And that's something to know about some of the early information on some of these kids. They're young, they're healthy, they don't have a lot of comorbidities. They're not particularly sickly, as far as, they're coming off several infections. In fact, one of the big questions was, well, wait a minute, did these kids test positive for the virus that causes COVID-19? In some cases, again, looking at world data, there was some exposure to SARS-CoV-2, but in some of the cases that the CDC is highlighting, they're saying that there's no documented cases.
Right.
They admit they wish they knew if there was prior infection. What do you think about that dynamic, that added dynamic of this new SARS virus that we're all wondering, well, what are the second and third order effects of it?
Yeah. So I think part of the issue that we have right now is that when we're talking about the cases, mostly in the United States, we're talking about cases that have happened over 7 months, back all the way to October of 2021. So the Omicron spike hadn't occurred yet. So a lot of kids hadn't been infected yet. It may have come off the Delta spike shortly before that. But we can't go back and say, hey, we need blood from back in October of 2021 from this patient to test for coronavirus. And so looking back retrospectively, it is going to be more difficult to do some of the diagnostic testing and treatment to try to figure out who had COVID, when they had COVID. But we do know a lot of these kids in the United States, they don't have a reported or documented history of having COVID. There are some cases in the UK that had they're currently actively sick with COVID or with some other viral infections, but that's not uncommon in kids, especially like daycare kids. A lot of times we run these viral panels and kids are positive for 2, 3, 4, sometimes 5 different viruses at the same time. And it's because all these viruses play together at daycare and at school situations. So it's not uncommon to have infections at the same time. But it looks like when we look at the majority of the kids, these up to maybe 300 kids, including the UK and the United States kids, it doesn't look like all of them are going to have active COVID-19 infections. And right now, we're not entirely sure about prior COVID-19 infections. So I think that a history of having COVID is still on the table as a possibility, but active COVID-19 infections is not a possibility. And the COVID-19 vaccination is not even on the table as a potential cause of this
We got a lot of
hepatitis.
questions on that. And I
Yeah.
could understand that because that was in the news recently about more access to vaccinations for children. But again, this goes back to October. And really, a lot of the data is on younger kids that would not be eligible for the vaccine. And, there's been further questions about whether or not they could be part of the trials. Listen, everyone's looking at that.
Yes.
So as far as what could be the factor here, the big takeaway for me as a parent is, as a layperson on this, is okay, wait a minute. So my kids could get what looks like a common cold that could also express itself as a little stomach bug, which sounds like everything my kids have all the time. And then they could get really sick. They could get suddenly really sick with hepatitis. So what should I be watching for as a parent?
Yeah. So if your child does have the stomach bug symptoms, so if they have vomiting, diarrhea, abdominal pain, some of the big red flag symptoms for this hepatitis and just in general, these are just general things. If you notice them, you need to be seen by a doctor. If you notice jaundice, so yellowing of the skin, something called scleral icterus, it kind of goes with the jaundice or yellowing of the eyes. The white part of the eyes gets yellow. Also really dark urine. And this isn't like they're a little dehydrated, it's a little concentrated. This is like a color that's like, oh, that's not a normal dark urine color. And then pale stools, kind of like gray or white poop. If you notice jaundice, yellow eyes, really dark urine, or light colored poop, we need to be seen in the emergency room. Those are all potential hepatitis or emergencies.
That sounds, at that point, it sounds pretty serious. Is it too late at that point to get really good treatment for something like that that's showing all those signs?
Yeah. So obviously, if they've had jaundice for a couple of days, it could be later in the process. But a little bit of bilirubin, which is what causes our skin to look yellow and our eyes to look yellow, a little bit of bilirubin means that there is some inflammation of the liver and that there is still time. We've got some time to get in and do some treatment and some supportive care.
Has this changed any of the way that you're thinking about treatment as patients come into the ER? Or what strikes you most, given your background, about this whole picture that is slowly emerging?
So, this is very fast moving, very similar to when COVID first started. The data was coming in very quickly. It was very fast moving. And so I think the most important thing initially was to alert all of my colleagues. We've got something new on the horizon. We need to be kind of keeping our antennas up for this new process that could be happening. And so I alerted my colleagues. I alerted some of my people online that could also kind of spread the word to make sure everybody knew about it. I think we are a little bit more likely to check labs to look for those liver enzymes to make sure that they're not elevated and that the kiddo looks okay. But I will say we're in the middle of a norovirus outbreak also, which is a stomach bug. We're seeing it kind of all over the country, increases in these stomach bug, vomiting, diarrhea cases. So it is a little more complicated because we're seeing a ton of patients that are sick, that have all these symptoms. But I think the most important thing is what we're telling people to watch out for. So we need to watch out for yellowing of the skin, eyes, dark urine, and pale stools. Those are some of the big things that I'm adding on to, the dehydration and persistent vomiting, decreased urination that I would already say for a stomach bug.
I had no idea about the norovirus. My family got a good dose of that right on New Year's Eve. So I don't wish that upon anybody at all. But thinking through it, norovirus, this, again, we're not quite sure what's causing the hepatitis. We know it's not hepatitis A, B, C, the typicals or the ones that you can get vaccinated from. I also wanted to ask you, though, in looking at this whole collage of what communities are facing, including in some cases a rising case number of COVID, but also RSV. That's something else that's out there for parents. as you're looking at that smorgasbord of different viruses and these are all could have a respiratory angle, what do you think parents should know?
I think that hopefully everyone has a pediatrician that they can reach out to and have a conversation with if they're concerned. But if you're not able to do that, or if you don't get the reassurance, or you're concerned, come to the emergency room. And if you have a pediatric emergency room located within a reasonable distance, we are specially trained to take care of kids, and we want to take care of kids. So we are available if you need the reassurance, if you are concerned, if you think the kid maybe looks a little yellow or maybe having a little hard time breathing. We are more than happy to take a look, and see how the kiddo's doing.
There was another part of the CDC conversation that was mentioned without any specifics, but it's definitely part of the conversation of what could be making us all more aware of what's going on with our kids. And the mention of the word mitigation efforts of the past. And of course, that meant a lot of our kids were not in daycare or weren't socializing in the same ways. Do you feel like you're seeing a different number of people into your ear? Is it even possible to compare, what you're seeing now to pre-COVID times? Are you seeing anything different compared to what you saw in the past that you could say to yourself, well, hey, that actually makes sense because, some of these kids just weren't, crawling around the gym floor, a couple hours a day. Do you think that's a factor in any of this?
I definitely think that there's a possibility it could be a factor, especially with the everything coming to light at the same time.
Mhm.
All of these potentially cases starting around the same time. And that's what helped bring it to light if it's something that was happening in the past. Something that was interesting last year in May, we saw this huge RSV outbreak where RSV is a winter virus and all of a sudden it's happening in the spring. And actually, as we speak, there's a huge influenza A outbreak all over the country. And it started the last week of April and now it's continuing into May. And this isn't flu A season. We would maybe a little flu B spike in this time of year. So what we're seeing is that COVID, the mitigation methods, all of it has created kind of confusion with these normal viruses. And so the seasons are shifting a little bit, and we don't know if those seasons are going to stick or if we're going to see things go back to normal, if you will, in the future. So I think that we're all just kind of taking it one step at a time and seeing where we're going. But the mitigation methods, and then all getting exposed to this viruses at the same time could play a part in this hepatitis. But I think we still have to wait and see what the data looks like.
Right. Too early to know. All right. Let me give you this scenario. I actually want to share this scenario. I don't normally like to share a lot of I want to stay focused on the news, but what happened to my family, I think could be helpful. And it risks outing myself as a negligent mother. So I just want to preface that disclaimer that this is something that I've really gone back and been like, oh my gosh, I could have really missed something. So that's part of the reason why I'm sharing it. My youngest was 4 months old when the pandemic hit, and he has two older brothers and sisters. So he has some exposure to germs, but he certainly wasn't in any of the scenarios that they were in, the trampoline parks and things like that I let them run around and lick the wall. And, before he wasn't in. So when he does get sick, he develops croup very often. So that's a really horrible cough. If you've heard it before, it doesn't sound great, not necessarily dangerous, but it sounds terrible. And it was a couple months ago where lo and behold, he got a he's got some sort of cold. He's having this croupy cough. I'm keeping him home, obviously, from any sort of activities. Doesn't really have a fever, definitely has a runny nose, definitely has a cough, but I've seen this before now. He's my third. He also has done this a lot, in the last couple years. I've tested him for COVID repeatedly. It hasn't been the case for him. And suddenly my husband comes home and he's like, we have to bring him to the emergency room. And I'm like, chill, I've been around these kids a lot. He's okay. He's going to be all right. But my husband's very like, we need to bring him. So I ended up bringing him to urgent care. And I had a friend there, not pediatric urgent care. And she said to me, yeah, he doesn't sound great. I think if he doesn't dramatically improve in a couple hours, I'd like to see him again. So, and by the way, I did this because our pediatrician didn't have any room. It was a time when Omicron was huge. No one had I couldn't get into a pediatrician anywhere. So I'm driving home. I get a sudden call from the pediatrician, and I end up waiting an hour outside their office, in the parking lot, waiting to be treated. And as I'm holding my son now, I can tell things are getting a little bit worse. He's watching PBS Kids. He seems otherwise happy, but he's not well. He's sick. By the time the doctor comes out and does that pulsometer, am I saying that correctly, Dr. Martin? Reading the oxygen, my son's oxygen level was like at low 80%. And the doctor said, we got to admit you to the hospital. So the speed of which this went from, hey, this is just a normal cough, to, oh my gosh, my son is not getting, that's not a good oxygen level. Anything below 95% could make someone a little bit nervous. Anyways, we ended up doing, getting into the office, doing a series of steroid treatments, but I was up all night with him doing those treatments too, and almost took him back to the ER because his levels dropped again. And, I was home alone with my 3 kids. And so the reason why I share that is because, I probably wouldn't have brought him I probably wouldn't have done anything. I would have been like, he's okay. He's a cold, but it changed like that. And I think that's what's a little bit scary. It's also scary about COVID. It's scary about the flu, the time between when a little body can go from being like, nah, they don't even have a fever. By the way, he never really had one, to then not being able to breathe, And so I really doubted myself as a mom. So I share that as a confession, but also I think it's a great example of like, how do with all this different stuff out there, like, is there that, obviously it's like, if you even have the thought, you should go. But is there anything else, looking back on even that scenario, or you're watching your child with a bad cold, like, is there anything else that you should watch for to say, what, this is really the time to get serious, and no matter what, get in front of somebody?
Yeah. I will say kids are resilient physically and emotionally. And one of the things that you actually mentioned is what we talk about a lot. Kids do this thing where we say they fall off a cliff. So they're going to be trudging along. They're going to be doing a great job. And all of a sudden they're just going to fall off the cliff, and they're going to get very sick very quickly. Where you and I as adults, we are going to slowly roll down that cliff. It's pretty obvious when an adult is getting sick. It is not obvious when a kid is getting sick, which makes pediatrics a very difficult specialty.
I'm sure.
I kind of leave it open a little bit to parents. If you're concerned, you can come in, but I'm an anxious mom, even as a doctor. And so I think about it all the time. And so I do have to kind of scale back and sit back and look at my child objectively. Are they having a hard time breathing? With croup, what we talk about is if they have stridor at rest. So that sound that they make, if they make that sound at rest when they're not agitated, not crying, they need to come to the emergency room. So shortness of breath, difficulty breathing, we need to see them. If they're starting to get dehydrated, so they're not peeing well, they're peeing quite a bit less than normal, less than 3 times in 24 hours, or they're not drinking, we need to see them. And then any change in their mental status. So if they're not waking up, they're acting confused, they're not acting like they should, they're allowed to be sleepy, a little grouchy, that's okay. But a change in their mental status, we need to see them. Those are the 3 big reasons to come to the ER. But if you're looking at your kid and you're just like, I'm really concerned and I'm not going to sleep tonight, that's a reason to come to the emergency room and get checked out.
Yeah, that, even just thinking about that, I probably should have brought him back, because it was that moment where you're like, oh, I don't know this, and it was really scary, and gave me a lot of appreciation. I moved to Texas a couple years ago, and I'm constantly thinking about life on the frontier, because there's all the Western, around me, and there's a real appreciation, also a love for history in Texas, that you're thinking about, what did people do 100 years ago? How did families make it, and especially living through this pandemic? If we are confronted by a doctor that maybe isn't taking us seriously, which sometimes can happen, pediatricians, even in a regular office, they can get busy. What do you think are the questions that we should be asking now? Are there any questions that you would say, hey, as a parent, if you're not sure, you're really being taken seriously on this topic, why don't you ask your pediatrician this? Any sort of cliff notes on that, Dr. Martin?
I think one of the things that you could do is try to get them to scale back a little bit and say, what is your thought process, doctor? What are you thinking about? Could you explain to me how you got to that conclusion? Because my thought process is thinking more along these lines. I think the other opportunity, especially if it's a more persistent concern, would be to bring an advocate with you, someone who can speak on your behalf if you get flustered or upset. or just to have another witness there to say, doctor, I don't feel like you're respecting what she's saying. Someone who you think will speak up.
Absolutely. Just a couple of final questions for you. I don't want to ignore this part of just getting back to this hepatitis of unknown origin. One of the things that came up, and it's also come up with COVID-19 for children, has been it's respiratory, yes, but it's stomach as well, and that the stomach symptoms are really there. Is that just what happens to children with cold viruses, respiratory viruses? Does it just commonly show up in, as a gastro issue, or is that something that's unusual?
So I think COVID, you could almost consider it like a flu-like illness. It touches all of the different parts of the body. It even touches the neurologic system with headaches and stuff like that. And you can have very similar symptoms. When we're talking about the adenovirus can kind of go two separate ways. It can be the respiratory virus, but the adenovirus 41 is more of a gastrointestinal type virus. So most of those kids are not having like the upper respiratory type symptoms. They're mostly having the vomiting, diarrhea, belly pain, fever, fatigue type symptoms. But it is not uncommon for viruses to do the whole smorgasbord of things in kids.
Again, one of the big lessons is that viruses can cause a lot of unusual things. Again, it sounds a very broad lesson over the last couple of years. I always like to end with this, which is I like to ask people what can make us a little bit smarter on a topic. And I'm just curious, just broadly speaking, over the last 2 years, working in healthcare, with 2+ years working in healthcare through the pandemic, now seeing some different things surface that could be stories, could not be stories. Anything that you would say to our audience, you know what, this is something that I've learned that's made me a little bit smarter about medicine, about treatment, about how to be my own parent and caring for my children or for my spouse. Anything that you'd like to share with them?
I think for me being kind of on the front lines and also being on social media and the exponential increase in the reading of scientific literature for me is trust the science. It's always going to be moving. There's always going to be more data. There's always going to be something more coming out. But the data is there. We just have to trust it. We're always going to be getting more. There's going to be bits and pieces coming in. So you don't have to glom on and follow something exclusively, but the science is there. The data is there. We just need to follow it.
That's really helpful. I think that is one of the big lessons for me as a journalist, is that you think that with science, the picture is static. And one of the things we learned is like, no, actually it is more like art, and it's okay. And that's one of the it's hard to accept that if you're not from a science field, wondering like, wait a minute, don't you guys know what to do here? Are we agreeing on this data? So this has been that's a really good lesson. Okay. Final question. How many different, you have a lot of like Marvel comic, Spider-Man, Captain America, hats, you have all like, what is the collection really like behind closed doors? That's what we want to know, Dr. Martin, because you always come correct with what you got for the kids. So what does it look like?
I probably have, and a lot of these have been gifted. I will say, I don't know if I've bought a scrub cap in a year and a half. I get gifted scrub caps and I love them. This one has buttons on it. It's great. I probably have about 25 of them. And I do try to match a little bit the scrub cap and the top, especially when I'm going to work. It's very important that the kids know that I'm on their side here.
Superhero in a lot of different ways. I would have estimated, like I would have put an extra 0. I would have been like at least 250. I mean, but that might be my problem. About how, you just want options. You want different things. Okay. Well, now we know what to get you. We'll have to figure out if we could get like the Smarter News logo. I'm like, good. I don't know if that would cross any ethical lines. I don't know, but I'm envisioning it. Dr. Martin, I really appreciate this. It's been fun to talk to you. It's fun to follow you. I really encourage everybody to check out your personal page and know that there's doctors out there like you treating kids in emergency rooms all over the country. It gives us a lot of comfort as parents. And I just enjoy learning from you. So I really appreciate it. Thank you so much.
Thank you for having me.
Quick, concise, nonpartisan, Smarter News, a refuge from the storm. I'm Jenna. Thank you for choosing Smarter.